Good evening, everyone. My name is Rachel Cotton. I'm the Community Resource Developer and Perkins Grant Coordinator for the Delaware County Technical High School. Tonight is our open house for the Medical Careers Program. I'm super excited to introduce all of our teachers that we have with us, as well as our DCTF staff as well, who will be here. If you have any questions at all during this presentation, please feel free to drop them in the chat or in the Q&A box. We will be answering questions at the very end of this presentation. So without further ado, I'd like to pass it off to the first medical careers teacher, and that will be...
That's me, Celeste Quigley. I can just introduce our other teachers here. So my name's Celeste Quigley, and I am the instructor at Delaware County Memorial Hospital. Then we have Ro Barraquette. She is at Crozier. Laura Walhoff is at Riddle. Amanda Butler is at Taylor. Sarah Connolly Smith is at Lankenau, and Mary Beth Murray is at Bryn Mawr. We do have another one. Honey Bodine is at Fitz. So as you can see from the slide here, whoops, oh, sorry, was that me or you? It is just offered to high school seniors. So just to make sure it's, so if you're a junior, this is when you would be applying. But if you're a sophomore, don't just jump off, because, keep this in the back of your mind, but just know that you couldn't apply until you were a junior rather. And our motto is where the hospital becomes the classroom. I don't know how much you know about this program, but we do teach out of the hospitals. And it is offered through partnership with the DCIU. So most of our students, all of them, want to pursue something in medicine. So post-secondary education to prepare for some kind of career in healthcare. 100% of our students do go on to college. So that's an impressive number. We can advance the next one. And here, like I listed, these are the hospitals where we are right now. So Bryn Mawr, Crozier, Delaware County, Mercy, Fitz, Lankenau, Taylor, and Riddle. And we do our best to try to accommodate geographically where your school is as to where we will place you at which hospital. We do take other things into consideration. If somebody lives one place but goes to school somewhere else, and it just works out better. It's not completely set in stone. We can work with you. Okay, I guess our next one. So there are two sessions, a morning session, which is 7 to 9 a.m. And then the afternoon session is 12 to 2. And you can see there are sending schools. I mean, I think that's pretty much all of them. Academy Park, Bonner Prendy, Chichester, Garnet Valley, O'Hara's on there. I'm not sure if we had somebody from Carroll this past year, but we're trying to get them into the program. They have to be, even if they go to Carroll though, they have to be a resident of Delaware County. And we've also had Delaware County Christian School has also sent students to our program. And I think I'm now going to turn it over to Sarah Connolly Smith.
Good evening. Glad everybody could join us tonight. I'm just going to touch on what we cover in our curriculum for a few minutes. Our curriculum is divided into 3 areas: academics, clinical rotations, and then patient care skills. Each of these sections of the curriculum really goes on throughout the year, and we kind of flip back and forth between what we're studying at the moment, and there's certainly lots of overlap in between those 3 areas. If you could flip to the next one, thank you. So just getting into this a little bit deeper into the academics, what do we cover? We cover a lot. There's a lot of material that we cover in our one-year program. Certainly there's a lot of anatomy and physiology content. If you are taking anatomy physiology right now as a junior, or you're planning to take it even in your senior year, not to worry. Your high school anatomy physiology class works very nicely with our medical careers program. We kind of pick it up and we reinforce a lot of that anatomy physiology and even go deeper into pathophysiology and bring in a lot of disease concepts within all those systems and case studies and research, and students really find that fascinating. We cover a lot of medical terminology and medical abbreviations. so that you are very versed to read patient medical histories, patient documents, understand medical jargon on TV shows. That's a lot of fun to be able to understand really what they're talking about and relay that to other people as well. We do offer quite a number of certifications throughout the course of our year. OSHA 10, American Heart Association, BLS, and First Aid, NOCTI Health Assistant as well. And we are incorporating Stop the Bleed as a part of our new certification that we offer to students as well. Additionally, we cover a lot of health science topics, including safety, infection control, law and ethics, so that you are more prepared for your career in healthcare, safe in the environment that you're going to work in, understand the principles of infection control and prevention. So we do cover quite a bit of those topics as well. Communication in healthcare, absolutely. We practice that in the classroom with a lot of role playing before clinicals begin, and then we really stress that while you're in clinicals, practicing your communication skills and preparing you for your future education, future clinical observations, and eventually your careers. Guest speaker program, we have a very, very good guest speaker program. We invite a lot of medical professionals from really every aspect of healthcare to come in and talk to us, and they give us their expertise, teach us a lot of their specific fields, and students really enjoy that aspect of our program as well.
Okay, this is, I guess, the main attraction of our program are the clinical rotations, which are an opportunity for the students to shadow all the departments and staff in those departments in the hospital. It's just shadowing, so nothing hands-on. They can watch patient care procedures. They can watch in the OR. They can watch, interact with the staff and the patients. And like it says, it's just observational. Sometimes, you know, a nurse may say, do you want to listen to a heartbeat or you want to feel a pulse? But for the most part, they're not going to be responsible for doing vital signs or anything like that. Usually it's 1 day a week, and we do like them to do a journaling and documentation of the clinical information. You know, we'll ask them to listen for medical terms that they've heard or procedures, or if there's something they don't know what it was, you know, write it down and ask us about it, because we do a post-conference after their clinical observation day. I think we can go on from there. So varies by hospital as to where they go, but they do all the nursing units, the operating room, the emergency department, pharmacy, intensive care unit, radiology, which would be X-ray, ultrasound, and CAT scan, and laboratory. And I think the next slide has a few more. Respiratory therapists, so they'll walk around the hospital with them. They may go to the cardiac cath lab, interact with the infection control advisor or staff member. The rehab services, some hospitals have, you know, they'll do acute care right there on the floors. Some of the hospitals have an outpatient facility, so they can shadow as there as well. Nutrition services, OB and pediatrics, but that's not at all the sites. And, you know, basically they're shadowing nurses, physician assistants. Sometimes they may be able to go into the patient's room with the doctor. They're with the doctors in the OR, PCT. So there's a lot of opportunity, and they can get to see a lot of different things. Okay, now I am going to turn it over to Ro, who is our Crozier teacher.
Hi, everyone. Happy to see you here tonight. So I'm going to talk about patient care skills. So there's a list here of the patient care skills that the students learn in the classroom. This year and last year, because of COVID, we actually bought their vital sign kits. So they have their own stethoscopes and blood pressure cuffs and gauze pads, things like that. So they can practice these skills at home as well. So these are skills, the students have to take a test in the spring. So a lot of these are skills that we go over in the classroom. So how to transfer a patient from bed to chair and back again without hurting your patient or themselves. Infection control procedures. We're going to start clinical in February, so they need to know how to put their PPE on properly. That part's easy. It's taking it off that is tricky. You know, you want to take off your PPE without contaminating yourself. The students are taught patient assessment, documentation, patient history, first aid, and CPR certifications, which I think most of us, if not all of us, have, all the students have received their certs this year. But in addition to these skills, we also teach other skills that they're not tested on. We just kind of do it as a fun day. So we teach intubation. The school bought a Fred the Head mannequin. We use a laryngoscope, ET tubes, and that's a lot of fun. But like when they go into a hospital unit and they see a patient who's intubated, pardon me, on a ventilator, they know where that tube is and why it's there. We also teach catheter insertion. We have these wonderful mannequins, nurse and mannequin. We can intubate her, we can put nasogastric tubes in her, we can put a Foley catheter, a urinary catheter, into her bladder. We can also teach IV insertion. So we take care of a lot of skills. And it's great that they have that before they start their college life and studies. Can you have the next one, please? There's a lot of pictures on these. These are some of the skills that they do. There's height and weight on the left. And then this is some of the students. I don't know which hospital this is, posing with their nurse and mannequin. The next one, please. And then we do, oh, sorry, there was another picture in there. We do, and again, we teach them how to do injections. So drawing up the medicine and having the proper dosage is just as important as the technique of giving the injection. So again, height and weight, blood pressure. Go ahead, you can move on, sorry. Intended careers, and these are pretty standard. Nursing, I think like a large majority of our students want to go into nursing, but we have a lot that want to go into medicine, whether they want to go, you know, medical doctor or surgeons, PT, OT, physical therapy, speech therapy, pharmacy. And the beauty of this program is sometimes people say, you know, I really want to be a nurse, or I really want to be a doctor. And then when they see what happens in the hospital, sometimes they change their mind. And I've had students who no longer want to be a nurse, and now they're in a pharmacy program or a PT program. And that's good. That's fine. Better they find out now than 4 years later. We do medical technology is another field, PA. And then some that students haven't even thought about when they come into our program. We have, because we talked about the guest speaker program, we had a perfusionist come and talk to the students virtually, just like this. That's the person who's running the heart-lung machine. If someone's having like open heart surgery, they need to be on bypass, they're the people who are running it. A dosimetrist, somebody who works in radiology and helps with someone's radiation treatment. So lots of different intended careers and majors. Sorry, you can move on. And then life after, I'm sorry, is this still me? I don't want to jump into somebody else's slide. Okay, life after high school, 100% college placement. All of our students go on to most 4-year programs. Some will go to Delaware County. I'm a Delaware County alum before I went to Westchester. But most, I think a couple years back, we looked and about 80% of our students stayed in healthcare. So we do track them through surveys and emails and social media. And many, it's just under 80% maybe staying in the healthcare industry. And a lot of our former students have come back as guest speakers, you know, whether they're OBGYNs, whether they're critical care nurses, physical therapists. It's great to have them come back. So my students just said it made them feel better, like this is attainable. Okay. Okay, I think this is you, Rachel.
Yes, this is me. So with our dual enrollment program, we offer a lot of different types of college credit opportunities for our students. Dual enrollment is a great way to start taking classes at the same time that you're taking your DCTS courses as well as your high school courses from your sending high school. With Widener University, we do offer many courses throughout the fall and spring. They do change typically year to year depending on what the university is able to offer us for our students. They're mostly general education courses. We do offer typically a medical terminology course with Widener as well. And a few other, maybe psychology, American civilization, English courses, different things like that, that students are able to start working towards their degree with the general elective and general education courses that they'll need to complete their bachelor's degree or whatever degree that they are pursuing. Both of these dual enrollment opportunities at these colleges are heavily discounted courses. So both of them, Immaculata is typically $100 per credit, so $300 for the course. With Widener University, it is also $300 for the course. So they are discounted compared to a full price tuition. And with books and everything with Widener, the courses are being held online. And with Immaculata, your DCTS teacher is your teacher at Immaculata, which is really cool to have, that you're already taking the medical terminology that you're doing at DCTS and implementing it into Immaculata University. So it's a great way to start the college credit. Both of the courses that you're taking at either Immaculata or Widener, you can only participate in one college at a time due to financial aid and FAFSA information. But with these, they are transferable credits. So if you decide that you want to go to a different college or university, you can take the credits from either of these schools with you to a different college or university, which is really nice. So. And I should also just mention, well, we're going to get into this as well, but we do also have additional college credit with articulation agreements that are credits awarded to students who complete the program. And with the programs, you can see the equivalency at the bottom that students are eligible to do. We also have a full page on our website of college opportunities that lists all of the dual enrollment with Immaculata and Widener, and also a list of the schools that we partner with for the medical careers program and for all of our other programs in general as well. So if you have any questions about any of those, you are more than welcome to reach out and visit our website for more information on our colleges and universities and how to obtain either discounted or free college credit, which is super exciting to have. I'm not sure who I'm passing it to, but.
It's me. So we just wanted to highlight again the guest speaker program that we have. Over the last few years, we've developed a very robust guest speaker program or guest speaker series where we are able to bring, you can see from some of the pictures here and some of the other things listed on the slide, that this allows us to bring in various healthcare professionals, throughout in all different fields, to introduce the students to all the possibilities. And we're able to bring some in person. And you can see on the next slide, we had a PA come in and do some suturing with the students, which is very exciting. But we're also, with the ability to zoom in, we are able to zoom in a lot of speakers from different states, different parts of the country, especially doctors and surgeons who have time constraints to spend their time, that hour or so with our students, sharing their perspectives, firsthand accounts of their jobs and responsibilities. So the students really kind of get an inside look at what that career looks like, and really opens their eyes. And I think this has been said before, that we have had many, from surgeons, to medical doctors, physicians assistants, nurse practitioners, nurses in all different fields, military nurses, critical care, flight nurse, etc. PTOT, speech and language. So the students are really able to get a decent perspective of all the careers that they might want to pursue. There's another picture of them suturing. So again, we bring in many different healthcare professionals to speak with our students. There's some pictures, as Ms. Barakat had said. We'll have respiratory therapists. They can come in. We also have Fred the Head, where they can actually firsthand try their hand at intubation. An EMS day, so we have the Crozier EMS. We'll also have Mainline Health coming in to do a day with our students to learn all about the emergency medical system. And as you can see from some of the pictures, very hands-on, really getting the students involved and excited. There's Temple's flight crew, and I know at Riddle we have Jeff Stat, and so we're able to tour the helicopter. Some want to go on a ride, but I don't think that's going to happen. But they get to see all the exciting things that we have to offer. And I'll pass it over to Honey.
Hi. So I have a couple things to talk to you about. So first, we have a number of certifications that we work on throughout the year. Probably the most important is going to be the CPR certification. The reason it's very important is for those students who are choosing to go to nursing school, they need to have the BLS, which is basic life support certification. It's specifically CPR for healthcare workers. And that's different than a standard CPR program that students might get. And so it sets them up for nursing school, and certainly is helpful if people are planning to go pre-med as well. Next one. We also do a Stop the Bleed certification. There is a nurse practitioner comes in and does the training and works with the students. It's kind of an exciting day. Okay, next one. We also have the HOSA State Conference. So I'm going to switch gears a little bit. The HOSA State Conference is part of our curriculum, but it can also be extracurricular in nature. It is actually it's an international organization. It's future healthcare students of the world, really. And these students are competing on various healthcare competitions, such as epidemiology, pharmacology, medical terminology. So our students, if they're interested, and many of them are, they get an opportunity to practice and then compete first on the state level. So our students will be going in, I believe it's like mid-March this year, to compete on the Pennsylvania state level. And if they do well, then they get an opportunity to then go on the international level. And this year it's going to be in Nashville at a really beautiful, beautiful hotel. And they get to compete with international students who have the similar interests. So it's a really, students love HOSA. It's a fabulous organization. And all of our students get to take part in whatever level they would like. They can do service if they want to, do like a food drive or something of that sort. That can be a part of the HOSA organization and our chapter, or they can compete in these kinds of testing or, testing situations. Next one. So our students in particular are a good fit for the National Technical Honor Society. This is an honor society, and it requires the students meet a certain GPA, and they get letters of reference. So very similar to an honor society, an academic, other kinds of academic honor society, and it is an honor. And I always tell the students, look, it goes on your resume, and you get to network, and so that's really a lot of the importance of programs like ourselves, like our program, is that you get to network with people and other students who are going into the similar areas. Next one. Obviously you're going to meet new people, so there's kind of a segue, meet new friends. Many of my previous students have gotten, nursing jobs and gotten leads on those kinds of opportunities through their friends they've made in programs like medical careers. So it's a wonderful opportunity. Next one. So this is actually a picture from the students went into the cardiac cath lab. at one of our sites. So you can see they're all suited up and ready to go. I'm very excited. So this is, it's unique for students to be able to go into these kinds of settings. Next one. So I guess you get the idea that this is a really wonderful program, and it is. It's a really great opportunity, not just for the moment for them learning the information, but also going forward, because they're making these friendships, they're networking, they're seeing things, they're connecting the information in real life. So our program is really, really unique in that way. If this sounds like your cup of tea, our applications are due February 28th. You need to see your guidance counselor to apply. And this is how you apply. Number one, there's a DCTS application. There's also, which is online, there's the medical careers application, which I believe is a paper copy. There's the essay, and then there's an interview. The areas that we're going to be looking at are your GPA. So we're looking for, 3.0 or above. Sciences that you've taken, the grades you've gotten, the rank, if possible, your class rank. If you're taking AP classes, honors classes, all of that looks great. Absenteeism, your disciplinary history, your extracurricular activities. And obviously we're looking at the essay and the interview. If you're interested, you should apply. We're looking at juniors coming into the senior year. The interviews would be April through May, and the decisions would occur early June. Next slide. You would need to get clearances. So there's a couple different clearances: criminal clearances, child abuse clearances, physical exam, proof of vaccination, TB testing, and obviously COVID-19 vaccination, because we're going into hospitals and, we don't want to spread anything. So that's the hospitals are saying that we need to have that. So the forms should be mailed over the summer if the student is accepted, and must be completed before September. The dress code obviously is the DCTS dress code and the hospital requirements. For us, it's a polo shirt, a light blue polo shirt. And if you're interested, I hope that you would check us out online at www.dciu.org, DCTS. Next slide. Any questions?
All right, so we did get one question, and it looks like a couple were already answered in the chat as well. So the first question is, how many students are typically accepted into the program each year?
So I'll join in on this conversation. So currently our application process started about 4 weeks ago now, and we still have a month and a half to go. We have about 100 applications, but the majority of the applications will be taking place between now and mid-February. Our teachers will be working with the sending districts and talking with their students and working with the counselors through the application process. We normally accept right around 170 students into the program. The program size per class is relatively small due to some restrictions with the hospital settings and medical career program. So we normally accept around 12 students per class. And so a teacher would be teaching roughly 24 students in the course of 2 classes throughout the morning and the afternoon session. So that's what we have right now. We do anticipate probably 250 or so applications. If somebody is on this Zoom session, virtual open house, who is an undergraduate, we would, meaning that you're in 9th, 10th grade going into 10th or 11th grade, we would urge you to consider one of our other health occupations, health science programs for your 10th grade or 11th grade year. We do accept students into the Med Careers program who have already been in one of our other programs. However, the vast majority of the students come to our programs, Med Careers, for their first year, their senior year with us. And as has been indicated, they're some of the top students in the county for a program that really is unique. I have knowledge of programs throughout the region here, and this medical careers program is by far one of the largest in the areas, if not the largest, and our connections with the local hospitals are just amazing. A number of the tech schools have really struggled in the last 2 years keeping those connections with the hospitals, but our dedicated teachers have done a marvelous job with keeping the doors open and keeping us in the hospitals this year and having access to the hospital settings so that our students can actually be talking with the professionals that are out there, the doctors, the nurses, the other healthcare people. So that's a little bit my 2 cents worth around the Med Careers program. Applications, it is a competitive application process. Dr. Palmer, who is also on this call, assists in reviewing the applications with the teachers and with our counselors. As I've indicated, about 170 students. We are pondering whether we will expand to another teacher this upcoming year. We do have that in our proposed budget as of right now for another teacher, either in our health services or in Med Careers. So we'll see what happens, but right now 170 students is around what we will be accepting.
Perfect. I have many questions that we just got in. So the first one, and I think you briefly touched upon this, Dr. Butts, how many students are typically accepted into the program each year?
170 students, and as I said, mainly the students are first year students with us. Most of the students are taking advanced placement courses back at their sending school or have taken advanced placement courses already or honors courses. It really depends on the school district, what is offered by them. And all the school districts throughout Delaware County can participate in the program. Some participate quite heavily. Some we only have a couple students, and sometimes it varies year to year.
Perfect, thank you. Our next question, what classes do you need and what do your grades look like?
I can answer that. We look for completion of bio and chem, and we need to see a B or better in both of those. We're very interested in the sciences. And we look for a minimum GPA of 3.0.
Perfect. Would you recommend the program for someone who wants to be a surgeon?
I'll chime in here. Hello, everybody. Yes, this is a great program for students who are interested in surgery or becoming a surgeon. A lot of students who are in the program currently or have taken the program or interested or pursuing surgical professions.
Perfect. I have 2 questions about COVID. How is COVID affecting students going into the hospital? And do you still need a COVID vaccine if you have a religious exception?
Well, as far as the COVID vaccine, it's 100% mandated that you need the COVID vaccine. I know just in the Crozier system that if employees have not gotten their vaccine, that they're terminated. So they will not allow a high school student to be unvaccinated if they're coming in for clinical. And how has it affected the program? Well, last year we didn't go to clinical at all. This year we are invited back. It's a little limited. Instead of going to the operating room 4 times, we're only going to go once. So we're tweaking our clinical experience a bit, but they are welcoming us. Some of the hospitals are welcoming us back.
I would just highlight the reality that as much as some of us sort of hate Zoom meetings, there is a benefit of how we have learned with Zoom and being able to do remote speakers and being able to offer some very unique presentations and speakers to our students, which have supplemented, haven't completely replaced the hospital experience, but I'm optimistic that we're going to all do what we need to so that we're in a better position in another month, and we'll be able to get into some of the good clinical rotation settings in our hospitals. But it is definitely a partnerships with the hospitals. That's one of the reasons that we have to adhere to the COVID vaccine requirements of the hospitals, and they're really the religious exemptions or a medical exceptions. We have to adhere to what the hospitals require of their own volunteers, because we're considered volunteers in their setting, and also they're generally the volunteers and the employees have to adhere to the same requirements.
Perfect, thank you. We did have a couple of questions that were answered in writing, but I just want to read them out so that they are documented for the recording when people come back to see this. Hopefully you come back to see this. The first question is, do you recommend taking anatomy in high school at the same time? The answer that was reported is you do not need to take anatomy at your home school during your senior year. You will learn this content in our medical careers class. If you have the option to take it at your home school and you want to do so, that is definitely fine. We do have some students who take it concurrently. And then the next question is, when is the application due and when are students notified when they are accepted? We have a soft deadline of February 28th for applications to be into your homeschool. Typically, students are notified in May as to if they're accepted. And where can you find the application? You can find it on our website, which is posted on the screen at dciu.org/DCTS.
So we are,
oh, go ahead.
As I've indicated, probably previously during this virtual open house or in one of the previous virtual open houses that we've had, the application notification, our intention is to move that up this year. The reality with the sending districts and also our own scheduling, May is getting extremely late in the scheduling process for seniors to be able to get the course content, their courses adjusted, and if they're accepted or if they are not accepted into our program. So we're looking across the board for the reason for the application deadline, and for medical careers, it's not really a soft deadline. I do anticipate having more than enough applications and students interested for the program by the end of February. So at that point, February 28th is really the deadline for programs. We will be working with the sending districts. So the key thing is you have to get your application in online. If there's information we're still working with the districts on, we'll work with the districts after that time frame, but we do need to have you in the mix of our potential students prior to the application deadline. Notification would be hopefully during the month of April.
Perfect. And all of that kind of goes along with the next question. When are applications available for the medical program?
So they're available now on our website. The supplemental application, and Ms. Cotton, if you can take a look at this and possibly with Dr. Palmer, look at our website. So the supplemental application, which is the second part of the application for medical careers, is near the bottom of our application page. And the link is there. You can also get it through your district liaison counselor. And it is a supplemental hard copy, as in return it to your guidance counselor, and they will get it back to us, so that it is a supplemental that is not available through our online application system. But the deadline still is the end of February.
Perfect. What are the medical programs for underclassmen and how do we apply?
So is Dr. Lomas on this call or Dr. Palmer?
Yes, I am, Dr. Butts. So the medical programs for underclassmen are our health sciences program, which can lead to a a medical assisting or patient care technician certification. We have our emergency protective services program is also considered one of our medical programs, and that leads to an EMT certification. We have a dental assisting program, which leads to a radiology certification and the ability to work as a dental assistant. We have an exercise therapy and sports science program, which can lead to personal trainer or assistant physical therapy, occupational therapy certifications. And then we have a biomedical laboratory and biomedical technology and laboratory sciences is an excellent program that gives you a good background in medical terminology, the systems of the body, and also has a forensics component to it. Students actually learn and solve the death of a fictional person through collecting hair samples, DNA, and all different kinds of medical samples, and then learning and then figuring out how the person passed. So all of those programs are open to underclassmen. The application process is similar. It is online. It does not have the supplemental application, so you can just go on the website and complete the application that's online.
Perfect. Thank you. The next question. How old do you have to be?
Well, you have to be a junior in high school. So I guess if you're young for your grade, then that doesn't really matter, I guess.
So the being a junior in high school currently, sorry, I'm getting some background.
Yes. So you have to be a rising senior. So it's only opened, we're presenting this to you as juniors so that in your senior year, you could take this class.
Perfect. The next question, will this count as credit for high school, and will we have to take more courses which will be replaced by this program?
I can jump on that, coming from ascending school prior. So typically this is an elective credit that goes towards your graduation status. It does not count usually as a science class going towards your science credits needed to graduate. So for example, you still have to take your bio, your chem, and your general science use your freshman year to graduate. So this does not count as one of those classes, but you will get an elective science credit typically towards your sending school.
And we have worked with sending districts, and having come from one of the sending districts previously, we have tried to get the sending districts to treat the medical careers program as a honor weighted or an advanced placement weighted course. Some of the districts do that, but recognition that it would fall in an elective area. So generally the medical careers program would fall in electives that a student would be taking away from the core academics of science, math, English, and social studies.
Perfect. Would you recommend this program for someone who works in the maternity area?
Yes, this program would be appropriate for people who are students who are interested in maternity, all types of professions.
Perfect. Is there an advantage to getting your application in early?
So the only advantage is that you can feel comfortable that your application's in. And as long as you're getting it in by the deadline of February 28th, all applications will be considered in the mix. And we do have to have opportunities for all students from the various districts based on the secondary enrollment of the districts. We also have to have opportunities for all the students that apply prior to or by the deadline to be considered. So as long as you get the application in to us by February 28th, and make sure you coordinate, make sure you work with your district counselors to assist in your application process so that everything is being received, as my lights go out here, being received by February 28th. You're in good shape.
Perfect. Because I am a sophomore, do I sign up next year?
So you would sign up, yes. So when you're a junior, you would fill out an application to be able to take this course as a senior.
Perfect. Will there be any hands-on care with patients?
No, nothing. Well, you go into patient rooms, but you're observing the staff as they are either interacting with the patient or performing a procedure on the patient, but the student will not be doing anything hands-on.
Ms. Barrett, can I just clarify, you work on each other, though you practice skills on each other, right, within your lab settings, correct?
Absolutely. In the classroom, there was lots of hands-on in the classroom, but yeah, but not with the patients. But you're observing a lot. You could be in the operating room watching a surgery be performed. You could be in the cath lab watching somebody have a vessel opened up in their heart. You observe a lot in the hospital. It's not a procedure. You're still looking at the interaction between staff. You're looking at communication. It really does increase their comfort level when they go to college and they are, doing the clinical portion of their class.
Perfect. Would this be a grade on our high school transcript?
It will be a grade on the transcript that gets transferred back to your sending school, and they issue credit based on your GPA scale.
Perfect. Is this program good for forensics?
Well, I think there's a biomedical program at the Aston campus that would be really good for forensics. Not sure if that would help you more.
So I would say both programs would be beneficial, but if you truly have a career pathway identified in forensic, the biomedical program may be something to strongly consider. it has, that's one of its key focuses. Medical careers has a focus much more broad in terms of the health occupations, in terms of the medical careers that a number of medical careers that students could go into.
Perfect. Could you provide the link for the application, please? So the website is listed on the screen at dciu.org/DCTS. When you go to the website on our main page, on the left-hand side, there will be a tab that says to apply to DCTS. So you can apply through that. But I cannot currently access the internet at the moment because I am displaying the screen. But if any of the teachers would like to provide the direct link, please feel free to put that in the chat box, not in the Q&A, in the chat box for everyone to see. So hopefully someone does that. Will we be in the hospitals this upcoming year due to COVID?
I can speak up here. The hope and the goal would be for all of our classes to be on hospital campus as we were pre-COVID. Everything is, could change, things can change, but that is the plan and the goal, to be in the hospital.
And currently we have 6, I believe, of the programs on hospital location, at the hospital location. Not today, because today they were doing a training, stop the bleed training here at Aston, but I believe we have 6 out of the 7 programs back in the hospital. We're optimistic that all of the programs will be back in the hospitals yet this year, are able to do some of the observations that makes this program unique. But even without that, the teachers have been able to do a marvelous job in providing experiences that just do not normally happen in a high school program. Opportunities with speaking with nurses, with doctors, with other healthcare professionals, which are quite amazing.
Perfect. The last question that I have, would we go to a different hospital each day to learn, or is there a classroom at one of the campuses?
No, you are at the hospital. The classrooms are on the hospital campuses. So just for instance, my hospital is at Delaware County Memorial. So my students typically come from Upper Darby High School because it's right next door. And then I do get some other students from sometimes from Academy Park, sometimes from Penwood, sometimes from Bonner Prindy, which is on the other side. So you're usually assigned a hospital, and that's where you will go every day. Unless sometimes, for big events, we may go to one of the campuses for CPR or things like that.
Perfect. I do not have any more questions that anyone has asked, but I do want to mention that the link has been provided for the direct link to the application process that you can find on our website. So that is located in the chat box, but again, on your screen is the general DCTS website. So if no one has any other questions, do any of the teachers or DCTS staff have anything else that they would like to add about the medical careers program or DCTS in general?
I just wanted to add, with the other healthcare programs, we did have a virtual open house last night for that, and there is a video of that open house posted on the website. So if you are interested in one of the other health related, please go on and check that video out, because you will see a video of all of those programs.
I just wanted to thank you, everyone who attended, and I hope I see your application in there. If you're willing to work hard and you want to have fun and learn all about the healthcare field, then this would be a good fit for you.
And I would just like to conclude our virtual open house and thank the teachers and our staff for participating. My judgment is by far we have the best medical careers program in the state, and the teachers, the dedication of the teachers, the work that they do is quite amazing. I have a family member that's in the medical areas, heading toward the medical areas, and I just wish he was able to have been in this type of program as he was going through high school, but unfortunately he was not. So I do want to thank everybody for your participation, and Ms. Cotton for the hard work that you have done with these virtual open houses. By all means, if anybody has additional questions, please follow up with your district counselors, your liaison counselors, or you can get in touch with us through our website. And there are email addresses available on our website on how you can reach out us or give us a phone call. So thank you everybody for participating in this. I greatly appreciate it, and good luck in the application process.
Perfect. This webinar was recorded tonight, and again, it will be posted on the website that is on the screen in front of you. Have a great evening and stay safe and healthy. Bye.
Night.
Thank you.